with Sweden Ghana Medical Center. And now there is hope for the cancer patient. You don't have to worry, don't give up now. As long as you are a Ghanaian teacher or relative, treatment is free. You don't have to worry, just keep hope alive. 'Cause with Sweden Ghana Medical Center and NAT, God will heal.
As a teacher, how are you preparing tomorrow?
It can be prostate, cervical, breast, endometrial, head and neck, colorectal, or any other cancer. They have no place here. Why? Because SGMC Cancer Center treats all solid tumors no matter the stage of the disease. We use advanced technology like radiotherapy, brachytherapy, and chemotherapy for our treatment. Locate us behind Lakeside Estate, Community 8, Katamanso, or call us today on 0201 409 403 or 0262 253 328 for inquiries and booking, and your cancer burden will be a thing of the past. NAT, NAGRAT, ECG staff, as well as their spouses and children below 18 years do not have to pay to receive treatment at SGMC. SGMC Cancer Center, taking away the burden of cancer.
Like and follow us on Facebook, Ghana National Association of Teachers -NAT. Follow us on Instagram, NAT_HQ. Subscribe and watch our videos on YouTube, Ghana Teachers TV. Follow us on X, Twitter at NAT Official. Read more about NAT on www.ghanateachers.com or email us through info@ghanateachers.com.
At a point, the Sweden Ghana Medical Center was established in Ghana with funding from the Sweden government. And at a point, Ghana attained the middle income status. And the treatment was subsidized. So they said they couldn't subsidize it for us. And it was a referral center for the sub-region. So at a point, they wanted to pull out. And when they were pulling out, at the time, even though NAT didn't own the facility, NAT was paying for the treatment of cancer for its members even before 2020. So we said we expressed interest, and council took a decision that we should own it. So we took a loan to support the purchase of that, and that loan is being serviced. Over 50 million Ghana cedi was taken as loan to help us secure that facility. Now the facility is for us. But taking over the facility, we realized that there are certain additions that we needed to do. The place has an MRI scan and other scanning devices, but they were not up to date. So there was therefore the need for them to get the modern scan device, which we call the PET scan. Basically, what it does is that one uses nuclear. They put some element of radioactive substance and is able to trace as it goes around your system. Then it gives a report about the health of your organs and tissues. So that one is able to give you the detail. When it gets to the heart, it tells you the health status of your heart, whether it is good, what is wrong with it. The machine is able to give a feedback, and they can go straight to where the problem is. And that is one in West Africa. We are currently installing it. The center is thinking of moving to solar. Currently, they have partnered with a company that has provided the solar, about 109 kilowatts of energy per hour. It is supplied. They are paying for it, but after 5 years, it becomes the property of the center. A whole lot of developments are coming on board, but we are also seeing that most of our members are not aware, and others are getting to know. But if we look at statistics from 2020 to date, Mr. Chairman, if you permit me, I will quote some of the statistics. In 2020, GNAT members across Ghana that were treated were 2,326. 2,326. In 2021, the number rose to 2,799. 2023, it went to 33,393. So if you multiply this figure by 2, you see that if you are projecting that if you have done this give and take, it should be times 2 or more. So by the close of the year, the figure is expected to rise. And if you look at the trend, you see that the numbers are increasing year in, year out. Now, we cannot say for sure that cancer cases are increasing, but it could also be that more people are becoming aware of its existence and are taking advantage. We do not have other secondary data to back this, but it could be that cases are rising, or it could be that more people are becoming aware and are taking advantage of the facility to treat themselves. So, in terms of treatment of cancer, it's quite expensive, and that is why in the wisdom of our leaders, they said, let's support each other. So GNAT as a great family has taken this initiative, and if you look at the demographics, from 1 to 30 years, this number that we are saying, the total for this period is about 13,751 of our members that have been treated between 2020 and then June 2024. 13,000. The outside members, those who are not GNAT members, we have people start from ECG and other organizations. They bring them. For them, they pay. Other teacher unions, NAGRAT bring their members. They also pay. And other individuals, it's a referral center, not only within Ghana, but the sub-region. People come there for treatment. So the other people, their number amounted to 23,270. But GNAT members, we treated 13,751. Looking at these numbers, 13,000, out of this, people in the age bracket of 1 to 30 constituted 4%. The age bracket of 31 to 40, 29%. Between 41 to 50 years, 33%. That is the peak. Then it begins to decline. 51 to 60, 23%, and 60 plus, 11%.
As a teacher, how are you preparing for your retirement, and how you invest
It can be prostate, cervical, breast, endometrial, head and neck, colorectal, or any other cancer. They have no place here. Why? Because SGMC Cancer Center treats all solid tumors no matter the stage of the disease. We use advanced technology like radiotherapy, brachytherapy, and chemotherapy for our treatment. Locate us behind Lakeside Estate, Community 8, Katamanso, or call us today on 0201 409 403 or 0262 253-328 for inquiries and booking, and your cancer burden will be a thing of the past. GNAT, NAGRAT, ECG staff, as well as their spouses and children below 18 years do not have to pay to receive treatment at SGMC. SGMC Cancer Center, taking away the burden of cancer.
Like and follow us on Facebook, Ghana National Association of Teachers-NAT. Follow us on Instagram, NAT_HQ. Subscribe and watch our videos on YouTube, Ghana Teachers TV. Follow us on X, Twitter at NAT Official. Read more about NAT on www.ghanateachers.com or email us through info@ghanateachers.com.
Welcome back from the break.
One thing that is making cancer deadly is at the time you will see the symptom, but then sometimes it is too late. And it is at the later stages that they say it is not possible to treat cancer. But if it is detected at the early stages, it is easy. Because if cancer is detected, depending on each stage, if it requires them to remove it surgically, they will do that. If it requires them to give it chemical treatment, that's the use of chemicals, chemotherapy. If it requires them to use radiation, that is concentrating and targeting the cancer cells with radiation, intense ones, it will burn that area filled with cancer cells, and normal cells will equally be destroyed. But the good news is that cancer cells are not able to regenerate when they are burned, but the normal body cells can regenerate. It means they can grow back. So depending on the stage, you can be treated and you enjoy your normal life. And that is why we are encouraging you that every year, please take advantage, go and screen. Screen yourself, encourage your partner to screen, encourage your children. Because if it affects your partner, you are equally down. God forbid, if it affects your child, you won't get the peace of mind to work. You even get the peace of mind to save, because everything is going into that place. So we are here to share the information and also give you the opportunity to ask questions.
Please, from the demography, you said that from 60 and above, it means that from what I have learned that even if you are on pension, you can still benefit. Is that not so? I wanted to ask about parents. That doesn't it cover parents?
For parents, we are not treating parents or extended family. It is limited to the nuclear family. Then respond to those on retirement. Yes, after the 2022 National Delegates Conference, the delegates were pushing for it. So last year, Council took that decision. So beginning people retiring 2023 and above, please, you know that laws do not take retroactive effect. So those who retired before 2023 cannot benefit. But starting from 2023 onwards, those retiring or who retired 2023, 2024, going forward, anybody who was a member and is suffering or diagnosed of cancer can access the treatment for free. So let our people still keep their records, their last retirement documents, especially pay slips. Please, that is the only thing
tomorrow.
It can be prostate, cervical, breast, endometrial, head and neck, colorectal, or any other cancer. They have no place here. Why? Because SGMC Cancer Center treats all solid tumors no matter the stage of the disease. We use advanced technology like radiotherapy, brachytherapy, and chemotherapy for our treatment. Locate us behind Lakeside Estate, Community 8, Katamanso, or call us today on 0201 409 403 or 0262 253-328 for inquiries and booking, and your cancer burden will be a thing of the past. GNAT, NAGRAT, ECG staff, as well as their spouses and children below 18 years do not have to pay to receive treatment at SGMC. SGMC Cancer Center, taking away the burden of cancer.
Like and follow us on Facebook, Ghana National Association of Teachers-NAT. Follow us on Instagram, NAT_HQ. Subscribe and watch our videos on YouTube, Ghana Teachers TV. Follow us on X, Twitter at NAT Official. Read more about NAT on www.ghanateachers.com or email us through info@ghanateachers.com.
Welcome back from the break.
Okay, I want to ask 3 questions concerning the fund. First of all, I would like to ask where we can locate those screening centers here in Ashanti region. Then the second question is that I would like to ask, I think from Chairman's point of view, he was making the inferences that the member is qualified to benefit from the fund and his or her spouse and 2 children. I would like to ask, for instance, if, let's say, a teacher who is a beneficiary from this fund marries, let's say, 2 women, who qualifies to get the benefit? Secondly, with the 2 children, I would like to also ask, when such cases happen, does the center do maybe a test to show that maybe the children are biologically from the father before they will accept to give the benefits? I would like to ask these questions.
We do not need a paternity test to confirm fatherhood. Fatherhood goes beyond sperm donors. Is that not it? Because we have men that culture calls them sperm donors. But in terms of legally, any child that bears your name, you have documented that this child is mine. The birth cert is there, the hospital, there are other documents, the school cards, there are other documents that will confirm that this child is mine. If you adopt the child legally, there will be documentation. So we will look more at documentation to confirm that the child is yours or otherwise. And then the place for scanning, Comfort is there, Petra is there, and even Petra has an insurance. The last time I went there, yes, there was one insurance of 1,500 that you could use to check everything within the year, scan from head to toe. 1,500. You take that insurance for a year and cover it. Because biopsy alone, the last time we took somebody there was over 3,000. Biopsy means the test that you do to confirm whether you have cancer or not. Okay? And that one was of the kidneys and the internal organs. But if it is a breast, any normal hospital or clinic can do the screening. The cervical, I don't know, but your secretary will get the centers available here for you.
My senior sister, when mobile phone landed Ghana, a lot of people were putting it on a vibration, and they were putting it, hiding it on their breast, and he suffered. He died like a dog. all the symptoms that my brother was saying showcased. He couldn't sleep, he couldn't sit, couldn't do anything. He was like a cat or a dog. So yeah, let us try to examine, make some exam. Now you know that men also can get breast. Are you aware? This morning when I told my daughter that we are going for cancer education and other, he was telling me a lot of things. I say, so let us think about our health. Our health is more important. When you die today, somebody will come.
Let's say I'm not a NAT member, and per today's talk, I'm being convinced to join NAT. And let's say 3 months later, maybe I was deducted twice or once, and I was diagnosed to have cancer. Will I benefit?
In NAT, we believe that there's no long things. If you become a member today, we just need pay slip, not pay slips. My presentation, I didn't say pay slips. It just needs a pay slip. So if your pay slip this month reflects NAT dues, and this very month, unfortunately, you are diagnosed of this thing, is that pay slip you present. That is how we do our things. We don't go to trace how long have you been. No. You are a NAT member. At the point of joining is at the point that you came in with this. We receive you, just like the law will say, approbate and reprobate. It means you want to choose and pick. It's a package that is given to you. And you receive the package and say, this one I don't want. You can't do that. So if we receive you both positive and negative. It's ours. So when you come in full. You are a member. Not that you come in with conditions. We don't give conditions.
Can a member receive multiple benefits from what we are talking about? Like, let's say this year I've enjoyed some, and then maybe after some years, and then I go to know that I have a problem in different parts. So the same person, can you enjoy this?
And that I was talking about, that he said it is being done now. With that device, it is not possible you will have multiples, because when you go under that PET scan, I gave the introduction that it's able to monitor all your organs and then tissues and give specific which one is having the problem, and they'll treat it. So if you go under the PET scan and you are supposed to have multiple infection of cancer cells, the machine would identify it. And like he was adding more this into it. Now with the help of that tracer, it's able to tell you that it is here. And the machine sees it. So they can position the, the radioactive distance. They will target those cells and treat you once. So with the new PET scan we are having, if you go in and they scan, it is not like the old one that you have diagnosed of here, they will treat you once. You go and come back with another. With the PET scan, any other condition that is relating to cancer or even any other ailment, they will tell you, they will finish and give you an advice on it.
The screening, can it be funded by NAT fully so that we, the members, at least maybe you may not have it directly, but later, when you grow old or after retirement or something, but you, the member, so that you will not have that sickness unknowingly. Can it be funded by NAT fully? That's what I want to ask.
The center is located in Accra. So if we adopt your suggestion that let us all go to the center and have screening there, you the one coming from Kumasi, somebody coming from Garu, to come and screen, apart from the cost to us, is it not also a cost to you and inconvenience to you? How will that be done? Are you getting it? So we are looking at convenience, and that is why they believe in outsourcing. If you want to specialize in treating the people, focus your attention on treating and other services that other facilities can render. Because for now, the whole Ghana, no other facility can do what we are doing. So why don't you concentrate on doing the bigger tasks and give the other smaller tasks to the other people? So that is the thinking, that if we allow the other small medical centers to diagnose you and you come, it is better than going to procure testing facilities, which will come at a cost, and a cost to you. Because let me say it, as we speak, the current 5 city is not able to fund the center well, because now we are paying 5 city. But because of union politics, we are not able to speak directly to the issue. But somebody must pay for it. So if we want to bring in on board for the screening, it means cost of that will go up, and our 5 city may go up to 10 city, which will affect other people. But people will say we don't want. So for now, we are thinking that let us walk in to the nearest facility and do the screening.
From the little knowledge I have, I know that from DNA mutations, we know that cancer cells can reproduce again when they are treated. So I would like to ask, for example, if a member has been diagnosed of cancer and he has been treated, will that member get another treatment when the cells reproduce again? If so, I would like to know the number of times a member needs to be treated when he's having a cancer.
I made mention that with the new technology that we are introducing, the machine is able to monitor the health or the development of cancer in the cells. Assuming a particular location is detected, scientifically they have a radius around which must be treated, because there could be cancer cells or other cells being, the mutation could be ongoing, but because it has not grown to the level of detection, you will not detect it, okay? Because there will be interaction around. So there's, scientifically they give a radius that if this thing is detected here, within this radius, you must treat around. So that is what we do. So if it is treated within that radius, you won't have any other growing. But like I said, with the PET scan, you are able to, it doesn't only go to one location, unlike the normal scan. This one goes through all the tissues and the systems, and is able to track and give individual health status of your tissues and organs. And based on that, they know where to target the treatment. And if multiple areas are detected, you are treated once. And where it is being treated, there's a radius within which they treat around. But let's assume that in the unlikely event that it occurs, as long as you are still a member, there's no limit to the number of times you can come in. But there's a limit to the number of people you can bring. But for yourself, there's no limit.
Cause with Sweden Ghana Medical Center,